New research on life expectancy suggests that we are approaching the limits of the human lifespan. And to learn more, we welcome Dr. Amit Shah. He's a geriatrician from Mayo Clinic, Arizona. Good to see you again. Thanks for joining us.
Great to be here.
All right, so this is a study on life expectancy. It's got a lot of people talking because it sounds like life expectancy is rising, but it's slowing down.
Right, which sounds like that wouldn't be possible.
Yes.
But, for a while, people thought, oh, everyone's living longer and longer and longer and longer. There's no topping off, right? We'll all live to 150, 200, whatever it might be, if with modern medicine and science. And, we had a period of extraordinary increase in life expectancy because of public health and because of immunizations and modern medicine. But that's slowing down now. We're not seeing the same gains. And so that maximum lifespan is not actually increasing at all.
The study suggests maximum life expectancy will likely stop at 87 average male and female. Does that sound about right to you?
Yeah, a little, about 3 years higher for women, for females, because they've always lived longer, and about 3 years younger for men.
So again, the higher end is easing a little bit, but the lower end is catching up. Does that sound about right?
Right. So it's this idea of like compression of mortality. In other words, we're doing really good at getting people now in larger numbers than we've ever had into their 70s, 80s, 90s. We've never had so many centenarians, for example. Many people might know somebody who's 100, but when you look at people living past 110, it's not increasing.
Well, and this study again suggested that if all deaths before the age of 50, were eliminated, it wouldn't make that much difference in the average life expectancy.
Right. Yeah, and that's just math and averages. Right?
Yes.
But it's shocking to people to think about that. It's sort of where the victims of our success. If we're going to really increase life expectancy, we really have to do something now about the biology of aging, not just about public health and vaccines and antibiotics, but now we're going to actually have to really affect how we age at a cellular level.
What is being done along those lines?
There's been a lot of research for many, many years on trying to expand life expectancy. Most of it has been done in fruit flies and worms and mice because they live shorter, and so we can actually study it. You give some newfangled drug to a human, come back 100 years and see if they live longer. So the studies are inherently difficult to do in human beings. But there are some targets, some cellular targets that try to get us to not age as quickly at a cellular level. Medications and various things which work in mice, but in a very controlled situation. But nothing is really proven to be all that great for human beings.
But with sanitation and antibiotics, as you mentioned previously, helping get to the rates where we are right now, is there not something in the works regarding things like cancer? That could really jump this number up?
Yeah, I mean, even if we were to cure cancer and cure heart disease and cure all these other things, there's still the aging process itself of the body that would still reach kind of a maximum lifespan. So if you look at the people who live to 120, 110, many of them have not had dementia, have not had cancer, but they've still died, right? And so it's that part of it. What do you do for the very healthy, the person who hasn't gotten cancer, they still die, right? And how do we actually push the envelope there? Barring any incredible breakthrough, which would then probably take another 100 years to work its way through the system, to prove, we don't really see that. And in studies that have been done over the last 30 years or so, we're not seeing any major breakthroughs in that maximum lifespan.
Sounds like there's a shelf life for human organs.
There is, yeah.
What about preventative care?
Right, so prevention can be very important, and that's what's getting people to live into their 70s, 80s, and 90s, right? So you're pushing it so that now that heart attack that might have happened to people in their 50s now is prevented because we have cholesterol-lowering medications, and so that heart attack may never happen or may happen when someone's 90. But that's preventative care. It also has like a maximum, is what we're seeing in countries that have very, very good preventative care and great life expectancy.
Where do people live the longest?
So there are several countries. The United States is not one of them. We have the most expensive healthcare system, but not the best, contrary to public opinion. And we have like Japan, South Korea, Italy, France. The best right now in terms of increases in life expectancy is Hong Kong. So not all of China, but Hong Kong is one of those areas. So lots of different areas of the world that are now approaching that 87, 88, maybe 90 if we're lucky, average life expectancy.
Yeah, but it's raising the lower level as opposed to raising the higher level.
Yes.
Yeah. Dr. Amit Shah, great conversation, interesting study. It's as we all age, we're kind of paying more attention to this, huh?
Right, and more important for us to make sure that we pay attention to all those things that help us to do really well when we're in our 80s and 90s. I'm a geriatrician, so I got to make a plug for that.
There you go. Dr. Amit Shah, thanks again for joining us. We appreciate it.
Good to be here.